Disclaimer. This podcast is for educational and entertainment purposes only. I am not a doctor and I am not giving medical advice. Peptides and research compounds are not FDA approved for most uses discussed here. Always talk to a qualified healthcare provider before starting, stopping, or changing anything related to your health. Never self-treat serious medical conditions. Use common sense, do your own research, and be safe. Alright, let's talk about one of the most famous, most talked about, and honestly most misunderstood peptides in the libido world. PT-141, also known as Bremelanotide. And if you've been in the peptide space for even 5 minutes, you've probably heard someone call it the female Viagra, or the sex peptide, or the instant horny shot. And that's exactly why we need to do a real episode on it. Because PT-141 is not Viagra. It does not work like Viagra. It does not work by increasing blood flow directly the way PDE5 inhibitors do. And it is definitely not as simple as take this and you'll automatically want to jump someone. It's powerful, yes. It can be extremely effective, yes. But it has its own mechanism, its own personality, its own side effects, and its own best practices. So in this episode, we're going to break down what PT-141 is, how it works, why it works differently in men and women, how people typically use it, how long it lasts, what to expect, common mistakes, dosing ranges, and safety concerns. And I'll also explain why some people think it did nothing, while others say it was like flipping a switch in their brain. Because that difference is real. And there are reasons behind it. So, let's start at the beginning. What is PT-141? PT-141 is a synthetic peptide derived from something called melanocortin. If you've heard of melanocortin 1 or melanocortin 2, you probably know those are tanning peptides. They stimulate melanin production. People use them to get darker skin, sometimes to reduce sunburn risk, and sometimes just for cosmetic tanning. But one of the side effects that kept popping up, especially with melanocortin 2, was increased sexual arousal. People noticed more libido, more spontaneous desire, more intense fantasies, more sexual sensitivity, more erections. And for some people, it was dramatic. So researchers started isolating that effect. They wanted to separate the tanning effect from the libido effect. And that's where PT-141 came from. PT-141 is essentially designed to target sexual arousal pathways without focusing so heavily on pigmentation. And unlike Viagra, Cialis, or Levitra, PT-141 works centrally, meaning it works in the brain, not primarily in the genitals. That's one of the biggest reasons PT-141 is such a unique compound. Because PT-141 does not just force blood flow. It interacts with desire. It interacts with arousal. It interacts with the mental part of sex. The craving. The wanting. The drive. That's why PT-141 is often described as it makes you want sex, not just it makes you perform better. Now, that doesn't mean it doesn't have physical effects. It does. But its main target is the nervous system. Now, let's talk about the mechanism because this is where it gets interesting. PT-141 activates melanocortin receptors. Specifically, it has activity at melanocortin 3 and melanocortin 4 receptors. MC3R and MC4R. And these receptors are involved in multiple things: appetite regulation, energy balance, mood, reward pathways, and yes, sexual behavior. MC4 receptors in particular are heavily involved in sexual function. When these receptors are activated, it can increase sexual motivation and arousal. This is why PT-141 can help even when blood flow is not the main issue. For example, a woman who has no desire, or a man who has performance anxiety, or someone whose libido is suppressed due to antidepressants, or menopause, or hormonal imbalances, or stress. PT-141 can sometimes override that mental barrier. Not always, but sometimes. And when it works, it can feel like a sudden awakening, like the brain remembers how to want. Now, let's get something very clear. PT-141 does not magically fix relationships. It does not fix emotional disconnection. It does not fix trauma. It does not fix resentment. It does not fix lack of attraction. But what it can do in the right person, is amplify desire. It can intensify sexual responsiveness. It can make arousal easier to access. And for couples who still love each other, but feel like their sex drive is dead, PT-141 can sometimes be the spark that reminds them what passion feels like. Now, PT-141 is actually FDA approved in a specific form. Bremelanotide is approved under the brand name Viagra, and it is approved for premenopausal women with hypoactive sexual desire disorder, HSDD. That's a clinical term for persistent low sexual desire that causes distress. So yes, this is one of the rare cases where a peptide-like compound has an FDA-approved application related to libido. However, the peptide community often uses PT-141 in research form, and many people use it in men as well, even though the official approval is for women. Now, let's talk about what PT-141 actually feels like. Because people always ask, what should I expect? And the answer is, it depends on your body, your dose, your sensitivity, and your baseline libido. But generally, PT-141 does not work instantly. It's not like a shot and 10 minutes later you're climbing the walls. Usually, onset is somewhere between 30 minutes to 2 hours. Sometimes it can take longer. And for some people, it builds gradually. It's not a sudden explosion. It's more like a creeping warmth, a mental shift. You start feeling more flirtatious, more touch-sensitive, more open, more interested, more turned on by things that normally wouldn't register. Some people describe it as a heightened erotic awareness, like the world becomes slightly more sexual. And in men, it can support erections, but it's not always immediate. It can increase spontaneous erections. It can increase morning wood. It can increase frequency of erections during intimacy. But it's not as direct as Cialis. Now, one of the biggest misunderstandings is people assume PT-141 is purely a physical sexual performance compound. It is not. PT-141 is a desire compound. And desire is complex. It involves dopamine. It involves mood. It involves stress hormones. It involves the brain's reward system. It involves confidence. It involves relationship safety. It involves body image. And PT-141 is essentially pushing the brain's sexual arousal circuitry to become more active. So for some people, PT-141 creates a very noticeable libido surge. For others, it feels like mild stimulation. And for some people, it causes side effects that make them hate it. So let's talk about those side effects. Because PT-141 is famous for one particular thing: nausea. If you've been around peptide forums, you know exactly what I mean. Some people take PT-141 and they're like, this is amazing. And other people take it and they're like, I felt like I was going to throw up for 3 hours. Nausea is one of the most common side effects. And it can be dose-dependent, meaning higher doses increase the risk. But some people are just sensitive. And even a lower dose can make them nauseous. Other possible side effects include flushing, like facial warmth or redness, headache, dizziness, fatigue, increased blood pressure temporarily, or a heavy body feeling. Some people describe it as feeling slightly hungover. Some people feel sleepy. Some people feel wired. And one weird side effect some people get is darkening of freckles or moles, especially if they have used melanocortin compounds before. It's less common, but it can happen. Now, there's another side effect people talk about that's less common, but important: increased blood pressure. PT-141 can cause transient increases in blood pressure and decreases in heart rate. So if someone has uncontrolled hypertension, cardiovascular disease, or is at risk, this is not something to casually play with. This is a real compound with real systemic effects. Now, let's talk about dosing. Because this is where people either have a great experience or they ruin it. Most of the time, people take too much. They want it to work, so they go big. And then they spend the night nauseous, sweaty, miserable, and unable to enjoy anything. In the medical version, Viagra is typically given as a 1.75 milligram dose, injected subcutaneously, and it's used on demand, about 45 minutes before sexual activity. Now, in the research peptide world, you'll see ranges like 0.5 milligrams to 2 milligrams. Some people even go higher. But most people do not need higher. Many people, especially women, respond well to 0.5 to 1 milligram. Men may use 1 milligram to 2 milligrams. But again, sensitivity varies. A beginner approach is usually best. Start low. See how you respond. And then adjust. Because you can always increase later. But if you overshoot, you can't undo it. Now, let's talk about the timing. PT-141 is not a daily libido supplement. It's not something most people take every day. It's typically used on demand. Like you plan an intimate night. You take it earlier. And then you let it do its thing. However, some people use it in microdoses more regularly depending on their research goals. But the more you use it, the more you need to consider receptor desensitization. Because melanocortin receptors can downregulate, meaning if you hammer them too frequently, you might reduce effectiveness over time. So the typical pattern is using it a couple times per week at most. Some people do once a week. Some people do once every 2 weeks. Some people only use it occasionally. Now, how long does PT-141 last? This is another reason it's so different from Viagra. PT-141 can have effects that last for hours. Sometimes even into the next day. It doesn't mean you're aroused non-stop. But the increased libido and responsiveness can linger. Some people describe it like a 24-hour sexual openness effect, where they're more easily turned on, more interested, and more responsive to touch. And that's why it can feel very different than a typical erectile dysfunction medication. Now, let's talk about men specifically. Because PT-141 has a big fanbase in men. And the main reason is that it can work even when PDE5 inhibitors fail. So if someone takes Viagra or Cialis and it helps blood flow but not desire, PT-141 might help. Or if someone has performance anxiety and their erection disappears because their brain shuts down, PT-141 might support the mental arousal side. Some men use it alone. Some men stack it with Cialis. And that combination is talked about a lot. Because Cialis supports blood flow and physical performance, while PT-141 supports libido and desire. But again, that's not medical advice. It's just what people commonly report. Now for women, PT-141 can be a game changer, especially for women who feel like their desire disappeared after childbirth, after hysterectomy, during perimenopause, during menopause, after long-term stress, after antidepressants, or just after years of feeling disconnected from their sexuality. Women often describe PT-141 as giving them a mental craving again, like their brain is remembering what it feels like to want intimacy. Some women describe increased sensitivity. Some describe more orgasms. Some describe more intense orgasms. Some describe more lubrication. But lubrication is not always consistent because lubrication is influenced by estrogen and vaginal tissue health. So if someone has vaginal dryness due to menopause, PT-141 may increase desire but not fix dryness. That's an important point. You might still need supportive interventions like estrogen therapy, DHEA, or lubricants, because desire and physical comfort are two different things. Now, another huge category of PT-141 users is people dealing with SSRI-induced sexual dysfunction. If you know, you know. Antidepressants like SSRIs and SNRIs can crush libido. They can also block orgasm. They can reduce genital sensitivity. They can reduce arousal. And they can turn sex into something that feels emotionally distant or muted. PT-141 has been explored as an option to help restore libido in these cases. And some people do report that it helps. But it's not a guaranteed fix. Because SSRIs affect serotonin pathways, dopamine pathways, and overall arousal circuits. So PT-141 may help some people break through, but it may not fully reverse orgasm issues. Still, it's one of the more promising compounds in that category. Now, let's talk about one of the most common questions people ask. Does PT-141 increase testosterone?
No.
PT-141 does not directly increase testosterone. It does not function like HCG. It does not function like enclomiphene. It does not function like testosterone replacement therapy. Its effects are more neurological. However, increased libido can sometimes lead to increased sexual activity, and that can indirectly influence hormones. But that's secondary. Now another question. Does PT-141 cause erections without arousal? Usually no. It can cause spontaneous erections in some men, but it tends to enhance arousal pathways, meaning you still need stimulation. You still need mental engagement, but it can make it much easier for the body to respond. Now, let's talk about how PT-141 is administered. Most commonly, subcutaneous injection. So that's typically in the belly fat, thigh, or another subcutaneous area. Some people ask about intramuscular, but most of the time, subcutaneous is preferred for this compound. Now, nasal versions have existed. There have been intranasal formulations in the past, but injection tends to be the most consistent route for research purposes. Now, let's talk about the number one mistake. Taking it too late. People inject it right before they want sex. And then they're like, it didn't work. Because they didn't give it time. PT-141 is not a 10-minute compound. You want to take it in advance. If you're planning intimacy at 9 p.m., you might take it around 6 p.m. or 7 p.m. And some people even earlier. It depends on how quickly you metabolize it. But the point is, it needs lead time. Now, the second biggest mistake. Taking too much. Again, because they want it to work. But then the nausea ruins everything. So if you're using PT-141, the best approach is to start with a low dose. Let your body adapt. And see how you respond. Because some people get excellent libido enhancement at 0.5 milligrams. And if they had jumped straight to 2 milligrams, they would have hated it and quit forever. Now, let's talk about how to reduce nausea. Because nausea is so common with PT-141 that people have created entire strategies around it. One strategy is dosing lower. That's the best strategy. Another strategy is taking it with food. Some people do better if they eat first. Some people do better if they don't eat. So that part is individual. Another strategy is taking an anti-nausea medication. Some people use ondansetron, also known as Zofran. Again, not medical advice, but that's something people commonly discuss. Another strategy is taking it at night. Because if nausea happens, you can sleep through the worst part. Some people will inject PT-141 and then go to bed. Then they wake up with increased libido the next morning. And they avoid experiencing the nausea as intensely. Now, does PT-141 make everyone horny? No. And I want to be very honest about that. PT-141 is not guaranteed. Some people respond strongly. Some respond mildly. Some do not respond at all. Why? Because libido is not just one pathway. It's not just one receptor. It's not just one hormone. If your libido is low because of relationship stress, PT-141 might help, but it might not fix the emotional issue. If your libido is low because your estrogen is tanked, PT-141 might increase desire, but you may still feel uncomfortable. If your libido is low because your testosterone is low, PT-141 might help temporarily, but you might need hormonal optimization. If your libido is low because you're exhausted, burnout, or depressed, PT-141 might not override that. So the best way to view PT-141 is as a tool, not a miracle. It's one tool in the sexual health toolbox. Now, let's talk about the psychological aspect. Some people describe PT-141 as increasing fantasies. That's real. Some people notice their mind drifting into erotic thoughts more easily. Some people describe feeling more dominant, more confident, more playful, more flirtatious. Some people describe feeling animalistic. And that's because melanocortin pathways are tied into reward and motivation. So, it's not just about the genitals. It's about the brain. Now, another thing PT-141 is known for is helping people with anorgasmia, meaning difficulty achieving orgasm. But again, it's not guaranteed. For some women, it increases sensitivity and makes orgasm easier. For some men, it increases erection quality and arousal, which can help orgasm. But if the orgasm issue is neurological or medication-induced, results can vary. Now, let's talk about safety and who should avoid it. If you have uncontrolled high blood pressure, this is not a casual peptide. If you have cardiovascular disease, you need to be careful. If you have a history of stroke, heart attack, or serious arrhythmias, this is not something to experiment with. If you are pregnant or breastfeeding, this is not something to use. If you have a history of melanoma or serious skin cancer risk, you need to be cautious because of melanocortin pathway involvement, even though PT-141 is not primarily a tanning peptide. And if you are taking medications that already affect blood pressure or heart rate, you should be cautious. Now, let's talk about frequency. How often can you take PT-141? In the FDA-approved model, it's not meant to be taken daily. It's taken as needed, and it's usually limited to a certain frequency. Many people in the research community aim for no more than 2 times per week. Some people do once per week. Some do once every 2 weeks. Because again, receptor desensitization is a real concern. And also, you don't want to constantly push your nervous system in that direction. It's like using caffeine. If you use caffeine occasionally, it's powerful. If you use it nonstop, it becomes less effective. Now, let's talk about PT-141 versus other libido peptides. Because people ask this all the time. What's better? PT-141 or Kisspeptin? PT-141 or oxytocin? PT-141 or melanocortin 2? Here's the simplest breakdown. PT-141 is one of the strongest direct libido peptides. It works centrally. It tends to increase desire and arousal. Kisspeptin is more about stimulating the reproductive hormone axis. It can influence LH and FSH. It can indirectly support testosterone production in men. It can influence libido indirectly, but it's not as immediate for many people. Oxytocin is more about bonding, connection, intimacy, and emotional warmth. It can enhance closeness, but it's not always a horny compound. Melanocortin 2 can increase libido, but it also strongly affects pigmentation and has more tanning-related side effects. So PT-141 is often chosen because it is more targeted to sexual arousal. Now, can PT-141 be stacked? People do stack it. Some people stack it with Cialis. Some stack it with testosterone therapy. Some stack it with oxytocin. Some stack it with dopamine-supporting compounds. But stacking increases complexity and increases risk of side effects. So if someone is new to PT-141, it's best to try it alone first. Learn your response. Learn your side effects. Learn your timing. Then you can make informed decisions. Now, let's talk about another question people ask. Does PT-141 work better in men or women? Honestly, it works in both. But the experience can be different. Men often focus on erection quality and sexual performance. Women often focus on desire and responsiveness. But both can experience both effects. And in many cases, women report more dramatic mental changes, while men report more dramatic physical changes. But again, individual variation is huge. Now, what about people who say PT-141 made them tired? That can happen. Some people feel sedated. Some people feel heavy. Some people feel like they want a nap. And that's why the take it before bed strategy exists. Now, what about people who say PT-141 made them anxious? That can happen too, because you're stimulating a central pathway. If someone is prone to anxiety, the body sensation changes can sometimes feel uncomfortable. They may interpret the flushing, the nausea, the warmth, or the blood pressure change as anxiety. So that's another reason to start low. Now, let's talk about duration again, because it's important. PT-141 can last longer than you want it to, meaning if you take it and it works, you might still feel increased libido the next day. That sounds great, but it can also feel distracting. So if you're taking PT-141 for the first time, do it on a day where you have privacy, where you can relax, where you're not going to be at work, because you don't want to be sitting in a meeting like, why am I thinking about sex right now? Now, let's talk about the concept of priming. Some people find PT-141 works better when they're already in a good environment. Meaning if you take PT-141 while you're stressed, annoyed, or distracted, it might not feel as effective. But if you take it while you're relaxed with your partner in a sensual environment, it can feel stronger. Because arousal is contextual. PT-141 can amplify signals.
But if there are no signals, it has less to amplify.
That's a really important mindset shift. This is not a drug that creates attraction out of thin air. It enhances what's already there. Now, let's talk about a real scenario. A woman in her late 40s. Maybe she's had a hysterectomy. Maybe she's entering perimenopause. Maybe she has stress. Maybe she has low estrogen, low testosterone, and she's exhausted. Her libido is gone. She feels like she used to be a sexual person, but now she feels numb. PT-141 might help her brain reconnect to desire. But if she also has vaginal dryness, low estrogen, and pain with intercourse, then desire alone won't solve the whole situation. That's where people need to think of libido as a system.
Brain,
Hormones, blood flow, nervous system, emotions, and tissue health. PT-141 can address one major piece, which is arousal signaling in the brain. But it may need support from other interventions. Now, what about men who have erectile dysfunction? If the issue is purely vascular, meaning blood flow, PT-141 might help, but Cialis may be more direct. If the issue is psychological, PT-141 might help more. If the issue is hormonal, like low testosterone, PT-141 might temporarily increase libido, but the foundation still needs to be addressed. So again, it's a tool. Now, let's talk about the after effect. Some people say they feel emotionally connected after PT-141. Some people feel more affectionate. Some people feel more cuddly. Some people feel more loving. And some people feel more primal. So the emotional effect varies. But because PT-141 is working through central pathways, it can influence mood and bonding indirectly. Now, can PT-141 cause increased appetite? It can. Melanocortin pathways are involved in appetite regulation. Some people notice appetite suppression. Some notice appetite increase. But it's not consistent. Now, can PT-141 cause hyperpigmentation? It's less likely than melanocortin 2. But it can still influence pigmentation in some people, especially if they are genetically prone. So that's something to watch. Now, what about long-term use? There is limited long-term data in the research peptide world. In clinical use, it's considered acceptable under specific guidelines, but it's not something meant for constant daily stimulation. Most people treat PT-141 like an occasional enhancer, something to help restore sexual confidence, something to help break out of a rut, something to help a couple reconnect. Now, one of the coolest things about PT-141 is that it can be psychologically empowering. Because when someone has low libido for years, they start to believe that part of them is gone forever. They start to think, I'm broken. They start to think, I'll never feel desire again. And then PT-141 can sometimes prove to them that the circuitry still exists. It's still there. It might just be suppressed. And even if PT-141 isn't the long-term solution, it can be a clue. It can show you what's possible. It can show you that the body can still respond. And then you can build a more sustainable strategy. That might include hormone optimization, sleep improvement, stress management, relationship repair, nutritional support, exercise, and other peptides that support overall vitality. Now, let's address one more important thing. PT-141 is not a love drug. It doesn't make you fall in love. It doesn't create emotional attachment. It can increase arousal and desire, but it doesn't replace emotional compatibility. And I say that because sometimes people take PT-141 and realize they're not attracted to their partner. And that can be emotionally intense. So be aware. PT-141 can amplify truth. Now, let's talk about the practical side. If someone is reconstituting PT-141, they might have a vial, often 10 milligrams, and they mix it with bacteriostatic water. Common mixing amounts are 1 milliliter, 2 milliliters, or 3 milliliters. The more water you use, the less concentrated it becomes. and the easier it is to measure smaller doses. For example, if you have a 10 milligram vial and you mix it with 2 milliliters, then each 1 milliliter would contain 0.5 milligrams. If you mix it with 1 milliliter, then each 0.1 milliliters contains 1 milligram. So people often choose the water amount based on how they want to dose.
Now, storage.
PT-141 is typically stored refrigerated after reconstitution. And like most peptides, it should be protected from heat and light. Now, let's talk about what PT-141 is not. It is not a fat loss peptide. It is not a muscle-building peptide. It is not a longevity peptide. It is not a hormone replacement. It is primarily a sexual arousal and libido peptide. But interestingly, libido and vitality often go together. Because when libido improves, people often feel younger, more alive, more confident, and that alone can improve health behaviors. So it can indirectly contribute to overall wellness. Now, I want to talk about expectations. If you take PT-141, you should not expect to become a different person. But you may feel like a more sexually alive version of yourself. And that can be amazing. But you should also expect the possibility of side effects, especially nausea. So if you want to try PT-141, you should plan for it. Start low.
Take it on a relaxed day.
Have hydration available. Have food available if that helps you. And don't schedule a major event afterward, because you don't know how your body will respond. Now, is PT-141 addictive? Not in the traditional sense like opioids or stimulants. But anything that creates intense pleasure can become psychologically reinforcing. So some people may find themselves wanting to use it frequently. And that's where discipline matters. Because if you overuse it, you may lose sensitivity. Or you may start relying on it mentally. And ideally, PT-141 should be a tool, not a crutch. Now, another interesting point. Some people find that PT-141 works better after a few uses, meaning the first time was mild and the second or third time was stronger. That could be because of timing, dose adjustment, or reduced anxiety about the experience. So if someone tries it once and it's underwhelming, it doesn't necessarily mean it will never work. But you should still be cautious. Now, let's talk about the difference between libido and arousal. Libido is desire. It's the wanting. It's the craving. Arousal is the physical response. Blood flow, sensitivity, lubrication, erection. PT-141 tends to increase libido, but it can also enhance arousal. However, if someone has physical issues like nerve damage, poor blood flow, or hormonal dryness, the arousal response may still be limited. So again, PT-141 is powerful, but it is not magic. Now, what about women who say PT-141 gave them more orgasms? That is a common report, and it may be due to increased sensitivity, increased arousal, increased blood flow indirectly, and increased mental focus on pleasure. Because the brain is the biggest sex organ. When the brain is engaged, orgasms are easier. Now, what about men who say PT-141 gave them erections that lasted too long? That can happen. It is not as common as with some other drugs, but prolonged erections are possible. And that can be dangerous if it becomes priapism, meaning an erection lasting more than 4 hours. That is a medical emergency. So if someone experiences an erection that will not go away, they should seek medical help. Now, let's talk about how PT-141 fits into the peptide world. A lot of peptides are about recovery. BPC-157, TB-500. Some are about growth hormone release. Ipamorelin, CJC, 1295, tesamorelin.
Some are about metabolism.
GLP-1s like semaglutide, tirzepatide, retatrutide. Some are about immune function. Thymosin alpha-1. Some are about cognitive enhancement. C-Max, C-Link. PT-141 sits in a unique category. It's one of the only peptides that is directly and strongly linked to sexual desire. And that's why it's become so popular. Because libido is one of the most common complaints in aging. And libido loss affects quality of life. It affects relationships. It affects confidence. It affects mental health. And it often goes unaddressed. So PT-141 has become almost iconic in this space. Now, let's talk about a few myths. Myth number 1. PT-141 works instantly. Not usually.
Give it time.
Myth number 2. PT-141 is the same as Viagra.
No.
Viagra works peripherally. PT-141 works centrally. Myth number 3. PT-141 works for everyone.
No.
Some people don't respond. Myth number 4. If PT-141 makes you nauseous, it's not worth it. Not necessarily. You might just need a lower dose. Myth number 5. PT-141 will fix your sex life. It can help, but sex life is a system. Now, another thing worth mentioning is that libido is not just about hormones. People always think libido equals testosterone. And yes, testosterone matters. But libido is also dopamine. It's also mental stimulation. It's also stress levels. It's also sleep. It's also thyroid health. It's also estrogen. It's also progesterone. It's also confidence. It's also how safe you feel with your partner. PT-141 is targeting one powerful pathway, but it's not the whole story. Now, what is the best type of person for PT-141? In my opinion, the best candidate is someone who still has the potential for desire, but the signal is weak. They remember being sexual. They want. They feel like something is missing. They might feel numb. They might feel disconnected. They might feel like their body doesn't respond the way it used to. PT-141 may help amplify that signal. But if someone is repulsed by sex, emotionally shut down, or deeply depressed, PT-141 may not be enough. Now, what about people who are already high libido? If someone is already high libido, PT-141 can be intense. It can increase libido even more. And some people love that. But others find it too much. So again, dosing matters. Now, let's talk about the vibe. Because PT-141 is not always romantic. Sometimes it feels raw. Sometimes it feels like a physical craving. So if you're expecting a soft, emotional intimacy experience, PT-141 might surprise you. For some people, it's more primal than romantic. Now, let's talk about what people commonly report. Common positive reports include increased desire, increased fantasies, improved erection quality, increased orgasm intensity, increased frequency of orgasm, increased sensitivity, increased confidence, increased willingness to initiate sex, and more satisfaction. Common negative reports include nausea, flushing, headache, fatigue, dizziness, increased blood pressure, and feeling unwell. So, it's a trade-off. But many people find the benefits worth it, especially when they dial in the right dose. Now, I want to address something important. If you're using PT-141, you should still be mindful of consent and emotional context. Because increased libido can make people feel impulsive. It can increase sexual motivation. And while that sounds fun, it can also lead to decisions you wouldn't normally make. So if you're using PT-141, do it in a safe environment, with a partner you trust, or with clear boundaries, because it can amplify desire and that can cloud judgment. Now, another question. Does PT-141 work for porn addiction or sexual dysfunction caused by overstimulation? That's complicated. If someone's dopamine system is desensitized due to constant porn use, PT-141 might increase libido, but it may not fix the underlying dopamine dysregulation. Some people might find it helpful. Some might find it makes cravings worse. So that's a situation where caution is needed. Now, can PT-141 help with female orgasm issues after hysterectomy?
Possibly.
But hysterectomy changes anatomy, nerve signaling, and hormones. So PT-141 may increase desire, but it might not fully restore orgasm if nerve pathways are disrupted. However, many women do report benefits. Now, what about menopause? Menopause is a major libido killer for many women. Estrogen drops. Testosterone drops. Vaginal tissue changes. Sleep changes. Mood changes. And many women feel like they lose a part of themselves. PT-141 can sometimes bring that part back, at least temporarily. But again, menopause is multifactorial. So PT-141 might be a spark, but hormone optimization and tissue support may still be needed. Now, if I had to summarize PT-141 in one sentence, I would say this. PT-141 is a centrally acting melanocortin receptor agonist that can significantly enhance sexual desire and arousal, but dosing and side effect management are everything. That's the truth. Now, if you're listening and you're curious about PT-141, here's the mindset I recommend. Respect it. Don't treat it like candy. Don't treat it like a joke. Don't treat it like a party trick. It's a serious compound. Start low. Learn your response. And use it strategically. Because when PT-141 works well, it can be one of the most powerful quality-of-life peptides out there. And for some people, it can literally save intimacy in a relationship. Now, one more point before we wrap up. PT-141 is not the only libido support tool. Lifestyle matters. Hormones matter. Sleep matters. Nervous system regulation matters. And sometimes, libido loss is the body's way of saying, you are depleted. So if PT-141 works, great. But also ask yourself why your libido was low in the first place. Because fixing the root cause is always the long-term win. And PT-141 can be a bridge. It can be a spark. It can be a reminder. But you still want to build a foundation underneath it. Disclaimer. Once again, this podcast is for educational and entertainment purposes only. I am not a medical professional, and this is not medical advice. PT-141 and many peptides discussed in the research community are not FDA approved for most uses. Always consult a qualified healthcare provider before using any peptide, medication, or supplement. Be safe, be smart, and do your own research. And that is your deep dive into PT-141, the libido peptide that works in the brain, not just the body, and has earned its reputation as one of the most powerful sexual wellness compounds in the peptide world. Thanks for listening, keep learning, and stay curious.